Non-HDL cholesterol is not directly measured. It is derived from a simple calculation subtracting high-density lipoprotein cholesterol from total cholesterol. While LDL cholesterol remains the primary metric for initiating and titrating lipid-lowering therapy, non-HDL cholesterol provides a more comprehensive estimate of the total atherogenic burden. It encompasses all apolipoprotein B containing lipoproteins in the plasma, low density lipoprotein, very low density lipoprotein, intermediate density lipoprotein, chylomicron remnants, lipoprotein little. Relying solely on LDL cholesterol can mask residual cardiovascular risk, particularly in patients with insulin resistance, type 2 diabetes, obesity, or metabolic syndrome. In these states, triglyceride-rich lipoproteins and their remnants are elevated. Furthermore, when triglycerides exceed 400 mg per deciliter, standard LDL-C estimation via the Friedewald equation becomes highly inaccurate, making non-HDL cholesterol a superior, highly reliable alternative. Another major logistical advantage, non-HDL cholesterol requires no fasting as the calculation does not depend on triglyceride measurements. Standard lipid guidelines establish non-HDL cholesterol treatment goals uniformly at 30 mg per deciliter higher than the corresponding LDL cholesterol goal. This 30 mg per deciliter allowance accounts for the normal circulating concentrations of VLDL cholesterol. Very high extreme risk category corresponding LDL goal less than 55 mg per deciliter, non-HDL cholesterol target less than 85. High risk LDL 70, non-HDL cholesterol less than 100. Moderate risk LDL less than 100, non-HDL cholesterol less than 130. Why exactly 30 mg per deciliter? The 30 mg per deciliter calculation is rooted in standard lipid physiology. Because total cholesterol is equal to LDL cholesterol plus HDL cholesterol plus VLDL cholesterol, subtracting HDL cholesterol leaves you with LDL cholesterol plus VLDL cholesterol. Therefore, the difference between a patient's non-HDL cholesterol and their LDL cholesterol is entirely dictated by the cholesterol carried inside VLDL. In a healthy individual with normal triglycerides, typically defined as less than 150 mg per deciliter, the circulating concentration of VLDL cholesterol is generally 30 mg per deciliter or less. Guidelines adopt this universal 30 mg per deciliter allowance as the standard upper limit for normal VLDL cholesterol. If a patient's non-HDL cholesterol is more than 30 mg per deciliter above their LDL cholesterol, it flags clinically significant excess remnant lipoproteins, usually driven by high triglycerides, that an isolated LDL cholesterol test would completely miss.